Hi, this is Dr. Lewis Clark. I want to thank you for taking time to watch this video series on a subject you probably heard about. I mean, it's been in the media and more people are talking about it all the time, and that is leaky gut syndrome. My purpose in this video and this videos to come is to not only help you understand what leaky gut syndrome is, but to also give you some natural solutions for the recovery of leaky gut. Now, first of all, let me tell you a little bit about myself. I'm a board certified chiropractor in the state of Texas. I'm also board certified in integrative medicine. I have over 29 years of experience. So we've worked with a lot of leaky gut syndrome patients over the years, but the symptoms are not always what you would think. So first of all, let me tell you that most of the symptoms that you have with leaky gut are not digestive in nature. Let me repeat that. Most symptoms with leaky gut syndrome are not digestive. Although you can have a lot of digestive problems like bloating or like indigestion or reflux or constipation, which is very common, or irritable bowel syndrome and those type of things. But most of the time, the symptoms are immune system related, meaning that you have food sensitivities, you have chronic infections, meaning you have autoimmunities. And the most common autoimmunities are thyroid problems or neurologic problems. So therefore, the most common symptoms are either thyroid or else they're immune system related in the sense of your nervous system. So with that said, I want to show you a couple of things here. Number one, there's a cycle or basically a wind up of leaky gut. So what does it start with? It starts with a loss of the tight junctions. And I'll go into this a little bit more at the end of this video. But tight junctions in your gut, there are cells that come together here to make what's called a tight junction. And those cells butt right up against each other. So therefore, they only allow the smallest particles to go down through between the cells and get into the bloodstream so they can go to your cells and do whatever they need to do. That's where you get your nutrients. That's where you're going to get all of your essential things that you need from your digestion into the bloodstream and then into the cell where it can be used. The problem is if we lose that integrity, if we lose that tight junction to the point where it opens up, now that's what's termed leaky gut. And so the cycle of that is now things are getting into the bloodstream that should not be in the bloodstream, like things like called antigens and peptides. Peptides are proteins that have not been broken down completely into amino acids. This is why you can end up with food sensitivities. The most common food sensitivities for this are gluten and dairy, because those proteins are very hard to digest and they're very immune reactive. But with that said, you can get also infections passing from the gut into the bloodstream. This could be bacterial, this can be viral, this could be even parasites and other things of that nature. Once that happens, you're going to have a lot of inflammation. Obviously, once it's inflamed, you're going to get more of the loss of tight junctions. So it becomes a vicious cycle, as you see here, and then ultimately we end up with multiple food sensitivities. Maybe you're one of those people who's gone to the doctor or even done an online food sensitivity test, and you had a handful or even more of food sensitivities. Well, that's a guarantee that you have lost the tight junctions and you now have a leaky gut syndrome. So with that said, let's look at the next thing. What are some of the things that are involved in contributing to leaky gut syndrome? Well, there's bacterial overgrowth. So if you have too much bad bacteria and not enough good bacteria, that's called dysbiosis, one of the most common reasons for leaky gut syndrome. And that can even go into an increase of what's called LPS, and that is a very inflammatory type of condition, so that can progress into that. Of course, you have immune activation. Your immune system now is activated. You may have yeast overgrowth. You've probably heard of candida. That's one of the most common yeast overgrowths that can happen. And ultimately, now you're ending up with intestinal lining degeneration. And you've got impaired intestinal immune integrity. We've already talked about dysbiosis, food sensitivities. Bottom line is now you don't absorb food well, so you don't get a lot of nutrients into your bloodstream to go to your body. And you wonder why I'm fatigued, why I can't focus and concentrate like I used to, and even things like why am I having insomnia. So this is part of the progression. Now I want to go into the mechanisms of leaky gut, because most people are like, surely I don't have leaky gut, right? Because I don't have any reason to have it. Well, let's see. What about your diet? Obviously diet's probably the number one reason why people end up with leaky gut. So do you eat gluten, dairy, processed foods, excessive sugar, a lot of fast foods, or alcohol? Those certainly in excess, and for some people even one of those could be an issue. Have you been taking any kind of medications like antibiotics, which is the number one, antacids, or corticosteroids? Or do you have chronic infections like H. pylori or yeast overgrowth we've already talked about, or parasites? And then what about stress? Stress could be a factor because of the production of cortisol. Stress can cause leaky gut by itself. And then we've talked about thyroid and other hormonal imbalances can lead to leaky gut. And there are neurologic causes because there is a connection between the brain and the gut. You should, if you're seeing this on YouTube, go to our YouTube channel and check out my video on the brain-gut axis, help you understand that. But trauma, strokes, neurodegeneration, all those things can cause leaky gut syndrome. And lastly, what about your blood sugar? What about inflammation issues? Those can also be a big problem. So I want to wrap it up with this right here, and next video we're going to go more into the solutions. But I want you to understand what we were talking about here, how you have these enterocyte cells in your gut lining. These enterocytes, when they have a tight junction, they only allow the things to get through that are supposed to. When these tight junctions are broken, these are the type of things you see in getting through, like the peptides, the proteins that are not broken down completely, like chronic infection issues, and then that activates your immune system. Once your immune system is activated, then you have further destruction into the gut lining, and it just becomes a vicious cycle. So if this is ringing home to you, stay tuned, okay? Because my next video will discuss how do we deal with this, and then how do we keep it right once we get it there. Looking forward to seeing you next time. Until then, live life well, and God bless.